we're going to dive into a little bit about wrist pain in yoga and Pilates. So just to quickly talk a little bit about the anatomy, we won't get too deep in the weeds here, but obviously the wrist is a very complex part of the body, including the hand. There's 29 bones in this area. So in the wrist alone, there's 15 bones, as you can kind of see in this picture. You have a bunch of ligaments. Almost all of these bones have attachment with a ligamentous structure that provides the passive stability to the wrist. And then we have all our muscles that cross along the wrist to provide that active stability. And these things are very important. A lot of the stress that we're putting on our wrist in yoga and Pilates has to do with maintaining stability when you're weight bearing, when you're pushing against resistance. So all of these things can factor into why we might have pain or discomfort with some of these positions. And then Valarie is going to talk about this a lot more, but there are definitely contributions from our shoulder, from our core, even from our lower extremity that may have to do with why we're experiencing discomfort in this area. So, you know, as with a lot of things, the whole body works together, and this is there's a lot of complication just in the wrist itself, but again, it's getting a lot of contribution from everywhere in the body. So where are some places that you might experience pain? So some kind of common culprits are the back of the wrist, where the is circled on that image, kind of along the side of the thumb, at the base of the thumb, in the center of the palm, on the outside part of the wrist, and then kind of across that front crease. And all of those areas, maybe to a whole number of reasons, but on the back of the wrist, you might be experiencing pain there if you have a little bit of impingement in the joint. On the outside of the wrist, there's quite a few tendons that cross that area that can get irritated and inflamed, and that might be part of the reason you're experiencing pain there. At the base of the thumb, this is a common spot to have pain from something like arthritis or an injury. In the middle of the hand, you may have pain if you're experiencing something like carpal tunnel. On the outside of the wrist, we have a big ligamentous stabilizer, one of those passive stabilizers I mentioned before, that can sometimes get irritated, especially with a lot of weight bearing and pushing. And then at that kind of front of the wrist crease, you may have discomfort there if you have tightness in the muscles or, again, one of those strains. So like I said, what are some reasons that you might have pain in the wrist? So some of it may be due to hypermobility. You may not have as much of that passive stability in your ligaments. You may have too much motion in your joints, and that may be why it's hard to find a comfortable position when you're weight bearing or pushing against resistance. You may also have some level of hypomobility, so lack of motion in joints, and this may have nothing to do with the wrist at all. Some of it, if you've had an injury or something like that, you may have some stiffness in the wrist that's limiting your ability to get into a palm flat position, or you may have hypomobility in other areas. So, you know, tightness in your hamstrings or something like that that may cause you to put more pressure through your wrist when you're getting into these positions. Arthritis is a common culprit. In the hand, often at the base of the thumb is a really tricky spot, but it could be in the wrist or in other joints. A wrist sprain, so that's an injury to one of those passive stabilizers to the ligaments. Carpal tunnel, so irritation of the nerve that crosses right through that palm area that was circled on the previous slide. Tendonitis, so having inflammation or irritation in the tendons, in those dynamic stabilizers that are helping us in those weight-bearing positions. And then, of course, you may be returning from some sort of injury or surgery, and that's what's contributing to your pain. So when you're thinking about returning back to some of these activities after you've had an injury or surgery, there's certain things that you should consider. Again, think about how long you were immobilized or how long you were inactive. If it was a relatively short period of time, you're probably going to have a quicker return to these activities than, let's say, a surgery where you were completely immobilized for, 6 to 8 weeks and you're just getting, trying to get that flexibility back before you get into some of these higher level activities. That's why I say in that bullet point below, think about your tolerance for day-to-day activities before you start to progress back to something like yoga or Pilates. If you're having pain when you're just kind of shifting weight in bed and putting pressure through your wrists, it's maybe too soon to go back to a lot of these things. And one thing that Valarie and I talked a lot about, and I recommend this to a lot of my patients too, is you can often benefit from doing a one-on-one session with an instructor, maybe just a one-time or a few-time thing to start to understand some of the modifications that you can use as you're getting back into your practice before going into a big class where, it's hard for the instructor to, make changes specifically for you. So that way you'll kind of know the positions that you can use to modify that may make it easier as you're getting back. So we'll talk a little bit about weight bearing. Like I said, in yoga and Pilates, weight bearing is a big part of it and a big reason that you might be having pain in the wrist. So there's kind of a progression I like my patients to go through when they're getting back to this, whether it's from a specific injury or surgery, or even they're just, kind of working to overcome pain. So kind of taking it back to a more basic level and then working to that full, maybe downward dog weight bearing position. So in this first picture, you can see I'm standing, so I'm in control of how much of my body weight I'm putting through the wrist. I can also change the angle of my wrist by moving my hands forward or moving them closer to my body. So I would start in this position, and once you're able to increase the amount of load and it's tolerable, you can kind of move on to the next. So in the next position, I'm standing with my feet a little bit further from the wall and my arms are closer to shoulder height. So again, now mimicking more of that position that you would be in like a plank, or transitioning through some of the like flow poses you might do in yoga. But I'm standing, so I'm still more in control of my body weight than I would be on the ground. Same with this as on the tabletop. You can start with your hands further out, further away from you, and work your hands down lower, especially if you don't have that full range of motion at first. Then you can get down on the ground, so now getting closer to what the posture you expect in a lot of poses, but starting with both knees down on the ground. So still controlling how much weight you're putting through your upper body and through your wrist, and then gradually working your way. So now maybe raising one leg, keeping one knee down before you make that full plank position. So there's some supports that you can use to help stabilize or offload your wrist that may allow you to get back into these postures sooner, even if you're experiencing some discomfort. So this Brace Lab device called the Wristable is great. It's, obviously something that you have to seek out, something that you can order online, and it sometimes is a little complicated to put it on. But the idea is that it helps to block kind of that hyperextension going too far back in the wrist, and so it prevents that kind of catching pain that you might get back there. But a much simpler solution that you can use just by getting something from the drugstore is this self-adhesive tape that you can wrap around the wrist so that it blocks that in-range motion. So you can see in this picture that I'm putting my hand flat on the table and extending my wrist, and the tape is kind of preventing me from going into a fully extended position so that I'm not putting too much strain. For pain on the outside of the wrist, this tape can be very handy for that too. I just like to anchor it closer to the outside where I'm having that discomfort. There are also some things that you can get off the shelf. So this bullseye brace or the wrist widget is a tongue twister.
You got it.
But it helps to provide a little external stability if the internal stability from the ligament is maybe not helping you out as much as you would like. These are great because they don't restrict your range of motion too much, so you're still able to get into most of the postures and positions that you want to get into, but it'll help provide you a little extra support there. If you're having pain in your thumb, you see with the hot pink tape, that's just a little elastic tape that I use to provide a little bit of support, provides a little cushion when you're doing weight bearing. Or this black neoprene brace is an example of something that you can get off the shelf. There's no rigid piece to this. It's all soft, so you're able to position the hand. But again, it provides a little cushion to the base of the thumb and also provides a little bit of support when you're getting into the weight bearing position. Some other useful positioning tools that Valerie's probably going to talk a lot more about, but using your yoga blocks to kind of bring the ground up to you, even just rolling up the front of the mat can be useful. And sometimes, especially if you're having pain in the base of the thumb, I like to roll up a towel so that you're not necessarily pressing flat down on your palms, but you can have more of kind of a relaxed grip around something soft. That can sometimes be more tolerable. All right, so now I'm going to throw it over to Valarie to talk a little bit more about posture and some modifications and more of the fun stuff.
Thank you, Emma, for such a wealth of information. It's super helpful to take a deep dive into the specifics and complexity of a place like the wrist, which is actually a pretty small geography when we think about it in relationship to the whole body. And it's also important to remember that Pilates and yoga are both total body practices, which means in order to understand why we might be facing challenges in an area like the wrist, we sometimes need to zoom out and take a total body perspective. And that means that even though the pain is here, there are a complex system of relationships and dynamics that are happening through the whole body that are contributing to what's happening in that one small place. And so that's where we start to expand the conversation and include concepts like alignment, core support, and movement mechanics. And so what do each of those mean? Alignment is your relationship to space. It's the relationship you have to the space inside of your body and also the relationship you have to the space around you. And it's determined a lot by the position of your spine and the balancing of your head, your ribs, and your hips along the spine in relationship to gravity. In order to have good alignment or to maintain good alignment, we need to develop our core support. When I say core support, usually people think I need to do 100 sit-ups every day so I can get those rock hard six-pack abs. And I just want to remind you that actually rock hard six-pack abs are often not the best path forward to developing good core support. When we think about core support, it's also not just one thing. Yes, it does include all 4 layers of the abdominals, but it also includes all of the musculature of the back, the hips, the shoulders, the neck, and the head. So again, we're looking at relationships and how things work together to provide good alignment, to maintain good core support, so that we can build good movement mechanics. Movement mechanics is how you do, what it takes to actually make the shape or complete the action. And some of the things we consider in that are how much effort or force is distributed through the body and where that force is concentrated. So if we don't have good support or we don't have good alignment, sometimes we'll have excessive force or compression falling into a place like the wrist, which can lead to wear and tear, can lead to injury, can lead to discomfort and compression. So when you work with Pilates and yoga, while they're both total body systems, they approach the same principles from different perspectives. And so in Pilates, a lot of the vocabulary and the approach is focused around core support and alignment. And as a result, you're getting that information in every part of the practice. Yoga is much more complex and layered in terms of what it's trying to achieve through the practice. And so oftentimes we'll find that yoga tempts us to collapse into our flexibility. And sometimes we don't get those reminders or that instruction about how important the core support and alignment is in the shapes that we're making. And that's why I just want to circle back to what Emma said earlier, which is it is crucial. If you want to practice these things, regularly, and really for anything you want to do, to try to find time to get at least one individual session that helps you begin to learn how your body works, how your pieces and parts fit together, what might be unique about the way you're built that makes certain shapes or actions more difficult for you, because each of us is unique. There's no one size fits all, and there's also no one solution for all. We are going to spend a little bit of time tonight helping you look at some of the general concepts that will inform good dynamics, good core support and alignment, as well as some modifications that will help you address wrist pain specifically.
All right.
Super. Okay, so we're going to take a look at Emma in standing first so that we can get a very clear sense of her alignment in relationship to her spine. If you'll just go ahead and step on the mat and stand profile to the camera, we're going to take a look at her. And what we want to see is where her head is in relationship to her ribs and shoulders and her hips. And that line is either really organized or maybe slightly forward or slightly back of that plumb line in her spine. And so typically we'll see people have a bit more of a sway in the lower back because they have a little bit less connection in the belly. And we'll also see some rounding forward in the shoulders and pushing forward in the head because we spend a lot of time looking at screens, working on computers, looking at our phones. And as soon as we lose that alignment and core support, it has a ricochet effect through the body. So if we even look down here at her knees, we can see that her knees are actually what we call hyperextended. And that makes her hips push forward and her belly kind of relax, and then her shoulders round and her head pushes forward as well to keep her from falling. So there's subtle adjustments, but if you don't mind, Emma, if you'll just take your hands to your belly actually, and just take a big exhale, and when you breathe out, your belly will go into your body. Yeah, so you'll pull your belly muscles gently in. Yeah, and that's the beginning of her core support. So now drop your hands, let your core go. Yep, and then when you breathe out, just draw your belly in a little bit back into your body. And you'll see how that pulls her hips underneath her, and that gives her a platform for her rib cage to rest on top. And then she can soften her knees, and that will help her unlock. And then we're going to also give her a little encouragement to open up through the front of her chest. This place in the front of the chest is actually one of the most important places for wrist issues, because when we come to weight bearing, if the shoulders are rounded forward, we get a lot more force coming down into the wrist. So this shape that we're looking at in a yoga class is called mountain pose or Tadasana, and a teacher would tell you that your Tadasana should travel into every other shape that you make. So the alignment that she's working on here and the core support that she's discovering here should come with her as she goes into weight-bearing shapes and more complex movements. So we're going to have you come down onto your hands and knees.
Okay.
And as she comes down onto her hands and knees, we're going to check, do we see that the head and the ribs and the hips are lined up, or do we see again that she maybe is a little bit soft in her belly? And so as she engages that core support, you'll see how the ribs and hips and head, they come to the same plane. Now, as soon as she comes to weight bear on her hands, we can't just think about the center. We also have to think about the shoulders and the arms themselves. And so here's where we're going to see that those rounded forward shoulders actually put her weight really heavy into her wrists. And so when she pulls her ribs into alignment, she has a better chance of drawing her shoulder blades onto her back. The shoulder blades connect to the back only through musculature. There's no bony attachment here to the skeleton. So the ribs provide the support for the shoulder blade to fit on the back and to create the optimal amount of stability that conducts the core to the arms. Another thing that we want to look at is the rotation of her arms. So Emma, if you'll just turn your hands all the way out to the sides, we'll see how that rotates her upper arms back. That's called external rotation. Without that external rotation, again, a lot of the weight will fall into the wrists in a weight-bearing position. This might be a great beginning modification to really find that core connection of the shoulder to the back. As you go along, you might be able to turn your forearm and hand forward, but keep your upper arms rolling back. So that's two things at once, which is exactly how life works. You've got external rotation in the upper arm and internal rotation in the lower arm, and that creates what we call a double spiral. The double spiral is what gives us the optimum amount of support and space inside the joints. So that pulls her weight up off of her wrists. It engages the musculature of the arms, connects the shoulders to the back. She's going to deepen her core again right here. Great. And then we can see that this alignment will go with her into anything more challenging. Take a quick child's pose just to come back off your wrists.
Feels great.
It feels great to have someone pick you apart, doesn't it? So you're going to come back up, and we're going to see how that translates into something more complicated like a plank. So if you'll step 1 foot back and tuck your toes under. Good. And we're going to work again to make sure that her core is connected, her shoulders are wrapping to her back. She has a little bit of that outward spiral in the upper arms, inward spiral. And Emma's also flexible, so we need her to just soften her elbows a little bit. Anytime we lock a joint, we put more compression in it, and that leads to wear and tear. When you're ready, great big exhale for your belly and step up onto 2 feet. So you'll see now how her plank position actually should look a lot like what she looked like in standing as well as in hands and knees. And this is how that core alignment and movement mechanics work together. So let's just have you kind of drift forward off your feet. Notice how now she's really heavy over her hands, a lot more pressure in the wrist. So drive your heels back. So actually what's happening in the wrist is greatly influenced by how much she works in her legs. If she disconnects from her legs, she's also putting too much weight over her hands. Good, and we're going to have her soften those elbows again so she can stay balanced, and then the head comes up just a little bit. The head is heavy, so if the head falls, guess what it does to the wrists? Also more pressure. All right, so here's the core support and the alignment. Come on down to your knees, and we'll take a child's pose to rest. She has the hard job of holding the shape. So plank, up dog, downward dog, side plank, those are all going to be informed by the same principles. Now let's say you want to practice yoga, you want to practice Pilates, but you're still learning a lot about alignment and core support and movement mechanics. That's great. We all are. It's a lifelong journey. So what happens if just being in a hands and knees position is too much pressure for the wrist? That's where we would bring in the props and modifications to help alleviate that pressure, and we're going to take a look at a few of those now. So we'll start off with blocks because these are going to be very common in almost every yoga class that you take. They're easy to adjust into different heights, and also they're easy to remove if you don't want to use them, which is really great for a flow-based practice, because then you can come on and off the blocks as you need to. So we'll start with the lowest setting because that's the most stable. And we'll just have you come back up to that hands and knees position. So you'll see here that when we put the blocks in place, essentially what we've done is lift her torso up to a diagonal. And as a result, the weight is balanced more over her hips and knees. And she can stay more connected to her core connection. And she's not fighting to hold the weight of her shoulders and head up. Right, so you have the choice of turning those blocks up one more setting, Emma, coming to the next height up, and that gives you even more support and relief in terms of weight bearing, right? There's also a special block that's shaped like a wedge. We don't have that one tonight, but let's get rid of the blocks and we'll show them how we can use the mat similarly. So when we roll up the mat, it actually provides less incline so that the wrist doesn't fold as deeply. So we place the hands on, heels of the hands on the mat, fingertips on the floor. And as a result, we just don't see quite as much of a fold in the wrist. So she has a little less pressure and force coming down. Another option here would be to roll up a towel. We have a blanket tonight and that might work, but it's a little bit thick, but let's take a look at how that feels to you as well.
Okay. Yeah,
right. So that also may give you that ability to dome the palm that you were talking about in one of your slides, where you have something kind of cushiony instead of such a hard surface to press on.
Yeah.
Okay, come on back to your child's pose and we'll take a rest. If folding the wrists is not a good idea in general, then we can try a modification where we come to the fists. And so we would use the fists on the mat in that hands and knees position. And in this case, we're looking to keep the line of the wrist fully stretched so we don't have any folding in the joint. Now, this requires a lot more stability in the shoulders and a lot more consistency in the core. And so it's not as great if you're going to spend a lot of time in a shape. It's something you can do for a brief amount of time before it becomes problematic. So let's say you're not necessarily feeling comfortable here either, then you can come all the way down to your elbows and forearms. And now we've taken the wrist completely out of the equation. At the same time, this shape will really show a lot more of the tension patterns that happen in the shoulders and the neck. So this can be a difficult place if one of the things you're working on is coming out of the shoulders in terms of how you're using your arm. This one is also not as great for a flow-based practice because it's harder to change positions and to move in and out of other shapes without having to push up onto the wrists. Yeah. Let's have you come all the way back up to stand, and we'll take a look at what it's like if we want to use other things like bands, weights, or the magic circle. All of the principles that we've applied so far travel with us to this next stage.
Okay.
And what we're going to zone in on is really the alignment of the wrist in relationship to the arm and shoulder. So if you wanted to do some resistance work with a band, and this would also apply to doing, go ahead and take two sides of it, to doing any work on the Pilates equipment, the way you hold the band really matters. So go ahead and extend your arms out to the front and just show us what it looks like when you pull your fists. So when I pull in this position, and maybe turn sideways so they can really see it, I've got a lot of force in the wrist here. And then I'm going to try and pull. And if we look at her here too, look at her core. And we could give her a little reminder to draw the core support into play, to pay attention to the alignment of the wrist. And when she pulls, she's pulling from the shoulders and the back instead of from the hand and the wrist, okay? So that's going to alleviate a lot of strain at the wrist, but it's a problem that's solved by the shoulders and the core. Good job. If she unlocks her knees, she'll have that access to her core that she's looking for. Excellent. Release the band. Take the weights. And we're going to do a basic bicep curl. So when you lift, just show us what it looks like if you let your, so we're not trying to lift with the hands, right? Again, we want those wrists to stay straight. We don't want to wing out. We don't want to wing in. We don't want to drop down. We don't want to lift up. Straight ahead, shoulders to the back, core engaged, and she's going to exhale, lift the weights from her belly, her back, her shoulders, and her arms. So her arms are working, but she's not disproportionately working at the wrists. Yeah?
Yeah,
Super. One more time. We're going to take the magic circle. This is a Pilates prop. And this is a pushing against resistance. So extend the arms straight out. And here we're going to actually open the fingers so that we don't have a tendency to grip and compress. And we're going to watch Emma's elbows. In fact, let's turn her around to the side again because we don't want her to lock her elbows either. We'll lower the arms just a little bit and we'll engage that core connection. And when she pushes on the circle, it won't be from the hands, it'll be from the belly and the armpits, the shoulder and back connection so that there's minimum strain in the arms and the wrist. These things are really important, and they apply also to your everyday life. So if I were picking up a bag of groceries, picking up my kid or grandkid, carrying a stack of heavy books, using my iPhone, I want to be checking whether or not I'm bending my wrist in a shape that is constant that leads to that discomfort and wear and tear. It's as important to pay attention to what you do in everyday life as it is to what you do in your practices. Thank you, Emma.
Yeah, thank you. That was great.